Well, it's a great pleasure to meet you, Dr. Minde, and it's also a great pleasure that you are the inaugural recipient of the prize that I was happy to set up for to recognize emerging GBD researchers. So I'd love to hear a little bit about how you came to do your work on cardiovascular disease and other topics that you've been pursuing. Um,
Thank you very much, Chris. It's a pleasure to meet you as well. And my story with cardiovascular disease and global burden of disease dates back to around about 2014-15, when I had just finished my medical training in Cameroon and, working as a clinician in the first hospital where I was posted to. So quite a few, a variety of people with different disease conditions. And I began to ask myself a number of questions that, okay, how many people, how many of people can afford coming to the hospital? Because this was a tertiary hospital I was fortunate to work in. And I thought about, okay, what about those who are unable to afford this care, those in the district hospitals? And what about those in the communities who can't even, who aren't making it to the hospitals? So looking at that, I began to think, okay, how do I implement the passion to help people as a doctor? I was like, how can I expand this impact beyond the hospital and into the communities? And I was like, okay, and if I had to do that, I also needed to understand which conditions were causing the most, problems in the community, and that was taking away lives as well. So I thought, well, perhaps I might have my answers by engaging in some research. And that inspired me to then start thinking about pursuing a PhD. And when I began to engage with the literature in preparing my proposal for my PhD application, then I stumbled on the global burden of disease studies. And these already provided quite some answers to the questions I was asking as a clinician, and providing this comprehensive information around, which diseases were causing the most problems and the most deaths, and prioritizing which ones, if I needed to do something, could have the most impact. So that's a bit of the inspiration from the beginning and how I engaged with the global burden of disease studies.
And I understand that you're expanding your scope from not just Africa, but looking in Asia as well. So where do you see your work going in the coming years?
That's correct. As you very well know, the burden of cardiovascular disease, or NCDs, is really growing in the low and middle income countries where most of these premature deaths are occurring. So I thought to focus my work in helping this sort of low resource settings, beginning first in Cameroon, my birth country, and then, as you rightly said, expanding to Asia, which in my current postdoctoral research, I'm expanding to Vietnam and Indonesia. And hypertension is what I've identified as one of the leading and largest risk factors for this cardiovascular disease burden. And so I'm like sort of looking for which simple interventions, can address high blood pressure. And so that's what inspired me in the direction of dietary salt reduction as a simple and cost-effective strategy potentially to address hypertension. And so that's how my work progressively expanded in that direction for dietary salt reduction and blood pressure, and of course the complications that we all see with strokes and heart disease.
So I have one more question for you, Dr. Minde, and that is, if you had to say anything to other early career researchers, what would be your bit of advice for them, given your experience so far?
If I had some advice for them, I think it's going to be patience and resilience, not giving up. Because along my journey just beginning, I've had quite a few pushbacks. For example, writing a paper and you submit to a journal and it gets rejected and those kind of things. So not to get discouraged, but to keep on and stay resilient, stay focused, and hopefully something will come by. And so I'm very grateful with this award, as it comes to encourage me along this journey and hopefully inspires other young researchers as well that this is possible.
Well, the bad news is that we all continually get rejected throughout our careers, but as hopefully we win more than we lose. It's a great pleasure to meet you, and congratulations on being the inaugural winner. There will only be one of you, so but more to come in future years. Thank you so much for your work today.
Thank you very much, Chris. It's a great pleasure, and thanks for inspiring this award.